preparing them for written and practical examinations, as well as for life as a doctor in the NHS. He also has extensive OSCE examining and instructing experience, and also part of teams developing questions and scenarios for examinations. And in addition to that, he has 5 years of experience as an approved clinical and educational supervisor for foundation year programme doctors, as well as clinical and educational supervision of GP specialty trainees. And his knowledge and experience of passing through the UK Medical School and postgrad training system as a junior and then a senior lecturer and examiner and a leader is invaluable for our Academy members going through any of the wide range of courses that we offer. Okay, so that's a little bit for you at the start there. I'm just now going to hand over to Miss Akira Javed, if that's okay for you to take over.
Hello, everyone. My name is Akira Javed, and I'm a 4th year medical student. And I'm the ambassador for Hive Medical Academy in Central Asia and also a Hive student. So I'm just going to share a few thoughts with you about the exam we will be discussing today and our future careers. We all are, I'm thinking, like we all are aiming to crack UKMLA and PLAB examination. These are like the licensing exams, so we should expect them to be rigorous and tough. And why should it be in any other way? Because these are like not normal exams. These are like life-saving exams. We're going to like save someone's life. So these are supposed to be tough for us. So here are my own reflection on why a lot of people may struggle with these exams and how Hive can help us. I think most of the people out here will not either have the right guidance from those who know the exam system and all the process. They must not know like from where they need to study and how they need to study for UKMLA or PLAB. They might not have got the proper direction, like they might not know how to study. Like most of us have a schedule that we follow from back from our high school system, that we get up, we study, and it's the night and the time gets over and we don't learn that much. So it's just because we don't know like from which direction we need to follow and what is the proper guidance that we need to follow in order to reach where we need to reach. And the third thing I think is that the correct content. Like most of the doctors out here must be studying from Robbins and they must be going through Davidson. Like these are like those precise books which we study, and it's like I think academically very good books. But what we need to know is for UKMLA and these examination, we need certain concise method and certain ways and certain direction that will help us out in getting to where we need to reach. And so content is very important, which we all lack. And the last thing is opportunity to practice. As it said that practice makes a man perfect. So practice is the key to success. And I think most of us knows the content, but we don't know how to solve the MCQs. Being a student, I am also facing the same issue that I cannot solve the MCQs that well. And for this, I think being the student of Hive Medical Academy, it have solved this problem of mine. At first, I was not able to solve MCQs this much, but now, right now, after going through Hive Medical Academy flashcards and again revising and knowing the things from Hive, I think I can solve certain MCQs. So because right now in UKMLA, the MCQs are getting tougher because the higher version. And like at first the MCQs were like one statement MCQs. What is the most common stone in urinary bladder? That type of MCQs were there. But now it's like there is a whole situation and there is going to be a scenario for you guys for which you have to tell that whether 58 years old man came, like this kind of long statements are going to be there. So you need a lot of practice and a lot of supervision. So in my opinion, you would not tackle any medical school exam or any other exam without these aspects being in place in the correct manner. So why take the risk with your licensing exam? I have found all the team at Hive to be extremely welcoming, and everything is done in such a personal way. Like I'm able to ask for anything I need from Hive team members, whether it to be an administrator or like CEO. Everyone is so welcoming, and now I feel like I am having a family and I can ask for anything from them. So I was their student and now their ambassador, and I'm so happy that I have found my family here. And I hope you enjoy the webinar today and you get all the answers of your questions, and I hope you get it soon. So see you guys again. And I would like to hand over the mic to Dr. Umar. So Dr. Umar, you may proceed with UKMLA and PLAB examination guidelines. Thank you so much, everyone.
Thank you, Akidat. Thank you, Michelle. Thank you, everyone else. First of all, thanks so much to everybody. Thank you for taking your time. Thank you for registering and joining us today and taking out your time on what is probably a bank holiday for a lot of people, I believe, 1st of May. So thank you. Hopefully you'll find it useful. So as you will have seen in the email and the messages that went out, obviously we have a few learning objectives from today, and it's always good to start with some learning objectives and make sure that we have an aim for the session. And so we've done that. So I'll just quickly go through them now, and then I'll go through the housekeeping stuff, and then we'll get growing. Okay, so everyone's here to learn about the UKMLA, important dates and who it affects. There are lots of people here as well to learn about PLAB and what will happen to it now because of the UKMLA. We'll be sharing with you all the official information that's currently available about the UKMLA PLAB as well, and how they relate to each other, how they are similar, how they are different, which one you will be taking. Obviously, we will share with you a bit of information about how we at Hive can help you as well. And finally, this is an opportunity for you to ask your questions, to share your concerns, and get any confusions clarified. So I hope that we are able to meet these today. So thank you once again for joining and for giving us your time. So I'm just going to briefly explain. So I'm going to do the main part of the presentation. I'm going to go through lots of information on UKMLA and PLAB and everything that we've discussed. After that, we're going to have a brief presentation for Miss Mirza, who does our English courses, because there are lots and lots of people on this webinar today who will have to take the English qualification courses. So whether that's IELTS or OET, and then a little bit on what we can do for you once you have reached the UK and CPD opportunities. And we have Dr. Ibi Funky, who's going to be sharing her experience and sharing her course offers as well today. In terms of housekeeping and ground rules, please, everybody just stay muted. You're fine to come on webcam if you want. Please make sure it's appropriate though for a public webinar, but please do stay muted. Put your, it's a really packed hour and a half, couple of hours, so please bear with us. Do ask your questions, put them all in the chat, or if you prefer, if you want to come on screen, you want to speak, you can do that at the end. Okay, fantastic. So once again, thank you all for attending. Thanks to the Hive and IT team, and also thank you to a couple of very special medical students from Sophia who wish to remain anonymous, but they really helped us set this up today. They know who they are, so thank you as well. Okay, brilliant. So let's get going. So we'll start a bit. First of all, actually, I nearly forgot. Right, I would really be interested in knowing how many people are here from which parts of the world. So please, if you wouldn't mind, just type your country or type your city into the chat, and let's see what kind of group of people we have here. This will not only be interesting for everyone on the webinar, but also for me, because then I can make sure that I cover everybody's situations and everybody's particular requirements. So fantastic. Thank you for putting in there. Varna, Bulgaria, Hyderabad, Pakistan, welcome. England, yay. Spain, Bulgaria again, Varna, Bulgaria, the EU, fantastic. The EU is a big place. Varna, Sofia, studying in Bulgaria, Plovdiv, Lahore, Pakistan. Lahore, known as the Paris of Asia. If anyone hasn't ever visited, do go and look at that. Right next door to the Lahore, Pakistan, is somebody from India. Most welcome to you as well. Okay, Sofia, Bulgaria, Japan, fantastic. Wow, Japan. I'm really into my 90s Japanese sports cars, so Japan is on the list for a trip. Plovdiv, lots of colleagues from Bulgaria, but people from all over the world. Okay, fantastic. Thank you so much. And do feel free to keep doing that through the webinar if you want to. Okay, let's get started with talking a little bit about the NHS and the foundation program in general. So based off the registrations we got and based off what some people have said here, obviously we've got a real mix of people who are either from the UK originally and gone to study elsewhere, or they are from outside the UK and they're studying in their home countries, or we may have also some UK-based medical students as well. But all of this information is applicable to all of you, so please do pay attention. So I just want to highlight this slide and just talk a little bit about the foundation program and how it fits into the entry system into the NHS. So obviously you have medical school. We can't be thinking about UKMLA or PLAB unless we think about medical school. So wherever you are, obviously you've got to get your degree first. And then if you are in the UK, or if you are coming from outside the UK and you want to enter the foundation year, the UK training program, most likely you will enter it in the FY1 or FY2 year, depending on where you are from and your experience, what exams you've done. The FY1 is equivalent to an internship, which is the terminology that's used in lots of places around the UK. And you are granted provisional registration once you have graduated from your medical school, once you've passed your finals or UKMLA, as we will learn shortly. That's your first year. And then when you move into the second foundation year, you will be fully registered with the GMC. And then, of course, there are other entry methods into the UK healthcare system as well, and we'll touch on them later on. And once you've moved through the foundation year program, you can then go into specialty training, whether you want to be a physician, a surgeon, a general practitioner like I was, or something else. Okay, so just briefly, we'll mention about specialty training. So we've already said foundation year training is 2 years. Then you can move into a variety of specialties, some of which are not included here. But obviously we've mentioned GPs, consultants, so that's in, whether it's in medicine, surgery, etc., whether you enter the specialty register or whether you enter the GP register, or whether you do, you don't go into medicine or surgery, or whether you do pathology or radiology or whatever else. That is all after foundation years, and it can vary between 3 to 9 years, depending on which one you choose. And then there is also possibility of subspecializing further. So I know we've got a mixture of people. We also have some postgraduates as well. Thank you to you guys for attending. So this is, for some of you, it's just the very, very start of your medical careers. For some of you, you might have more experience. For others, you might be very early on in medical school. So whatever your particular situation, you've got a fantastic career to look forward to, hopefully in the UK. Okay, let's leave the information on foundation year and specialty training behind and start to talk a little bit about the UKMLA and the PLAB. So we'll focus on the PLAB first, just because based on what people have said in the chats, and also based on the information in our registration, the vast majority of people are not UK-based medical students, at least on this webinar. And so PLAB is still really important and still really relevant. So the first point is that the PLAB isn't disappearing yet as its own entity. Okay, so PLAB is still remaining, at least for 2024, but the PLAB exams are going to move to the UKMLA content map. Now, we'll talk a little bit about this later on, but I've put here different question mark. Okay, this is just to remind me to explain that it is slightly different from the current PLAB content map, which of course is available via the GMC website, as is the UKMLA content map, but it's not that different, and we'll discuss that a little bit later on. Some key dates for you guys to remember. Now, these dates are the dates on which the current PLAB exams become compliant with the UKMLA content map. So, PLAB 1, 8th of August 2024, the content map that it's based on will move from the PLAB content map to the UKMLA content map. For PLAB 2, this will happen on the 17th of May, which is, of course, later this month. Again, just to reiterate, we'll move from the PLAB content map to the UKMLA content map. Few more important points. The eligibility criteria for PLAB is not changing. That means if you were eligible for PLAB before, whether it was based on the PLAB content map or whether it whether it's based on the UKMLA content map, soon your eligibility criteria will not change. The name isn't changing yet. The GMC have said that it's keeping its name, so it is a separate entity currently from the UKMLA, which at the moment is specifically for graduates of, for students at UK medical schools. So PLAB is keeping its name as well. It might be modernized or changed at a later date, but currently it's staying the same. And everything else about PLAB, about the format of the exams, about the application process, about the registration process, your eligibility, and everything else, you know, the specific pathways for you to do certain things or make inquiries, that is all staying the same. Okay, so how can you start practicing in the UK as an international medical graduate? And again, referring back to the chats in the messages, there were lots and lots of people on the webinar. And there was one person who said they were from the UK. Everybody else was from either Bulgaria, Pakistan, India, Japan, and lots of other places. You guys will be international medical graduates, whether you are a UK citizen or not. So what are the steps that you need to take to practice in the UK? Number one, earn your medical degree. Unless and until you do that, obviously the rest of the process can't start. So for all the medical students, do work hard, make sure you pass them exams, and then you can proceed on the rest of the pathway. After that, you have to either pass your IELTS or OET. Now, these are English qualification tests, which our English tutor and our English director will speak about shortly. I've put in that specific point if needed. Now, there are some medical schools, some places where the GMC will accept their qualification. Thank you. Will accept their qualification as proof of their English. But generally, this will not be done for the majority. So you have to check specifically with the GMC. But some people will be exempt. The majority will have to pass IELTS or OET. Then after that, it's quite straightforward. Pass PLAB 1. So obviously, if you've done that already, well done to you. Fantastic. And then after that, you have to pass PLAB 2. Just bear in mind that if you do these exams, if you do PLAB 1 before August 2024, and if you do PLAB 2 before the 17th of May 2024, these will be based on the PLAB content map, not the UKMLA content map, but that's a minor point. So let's not get hung up too much on that. Once you've passed your PLAB exams, then you have to register with the GMC. Then after that, it would be good for you to get some clinical experience or completing a clinical attachment. Reason being is that you may have trained, obviously you have trained abroad, and you don't have any experience of how the NHS works. And this helps in job applications and in interviews and lots of other things. And then the final step is, of course, securing a job. So these are the basic steps broken down. And of course, Hive is here for you at every stage to help. Let's move on to some of the specific pieces of information. I'm just going to briefly mention about the English proficiency test before handing over to our expert on it. So there are two types. There's the IELTS and there's the OET. For the IELTS, you have to have a score of at least 7 in each testing area and an overall score of 7.5. If this is all new to you, don't worry, you'll learn more at the appropriate time. And obviously, if you're already familiar with this, that's great. It's just good for you to refresh that. The OET is a slightly different test, and this requires a grade B in each testing area: speaking, listening, reading, and writing. So that's all I'm going to say on the English. And I'm just going to introduce Miss Mirza, who is our Director of Training and Development and our English language programs. She's got decades of experience as a master trainer and an educational consultant, and she's been an IELTS examiner and has done that for many, many years as well, and is much, much better placed than me to tell you about the English tests and the English qualification. Ma'am Noreen, please, if you can confirm that you're ready to go ahead, then I'll hand over to you.
Good evening, everybody. It's so good to see you all here, and so wonderful to be with a group of prospective students, people who will and are affiliated with the Hive Medical Academy. So welcome you all for today's information seminar. So thank you, Dr. Umar, for this introduction. I'm humbled. Thank you so much. Yes, I have about more than 35 years in English language teaching. I've been working I'm still working with the British Council as a consultant for various other projects also, including IELTS and OET examining and other things also. I've also been working with the Higher Education Commission Pakistan, and I've been a consultant trainer with the College of Physicians and Surgeons Pakistan for almost, it says 18 years, but it's kind of more than 20 now. I should update that. So let me give a very quick brief on what's the significance of English language for doctors, especially. I'll just very briefly say that today English is the lingua franca of medical international communication. It is an essential prerequisite for any medical career, so to speak. So English should be adapted in order to meet the specific academic requirement and also the professional requirements that any doctor would have all over the world. That is, language is communication, and communication is through language. Language gives you the power to communicate. To like in the PLAB exam, you all know that besides the written exam, the most challenging are the interactive exams, the way the examinations have changed. So how can you make your point? How can you communicate across so that you get your requisite position and you pass through these tests? It is a medium to express your ideas, your individual thoughts. It is also a skill. When we say it is a skill, which means that, yes, it can be taught, it can be learned. So yes, and you all know there are 4 components, English, which is speaking, listening, reading, and writing, and we cover all of them. Speaking becomes a little more, I would not want to say challenging, but a little more intrusive when we look at it, because it needs a lot of nonverbal. So we do that all, we discuss all that in our modules. So why the IELTS or the OET? Obviously, it's the third, English is the third most spoken language in the world, over 379 million speakers around the world. If you want to work, live, study anywhere in English-speaking environment, you have to go through these IELTS or OET tests. They are your first steps towards the career opening to you. It is an essential for many job opportunities, integration into the community. It is valid in so many countries, as I've mentioned here. It is globally recognized to be more than 11,000 employers, universities, schools, immigration bodies, and so many others. So you all know there are 2, PLAB 1 and PLAB 2, and our modules are more geared, my module is more geared towards a PLAB 2, which is the medical scenarios that you have to work with. The validity, many people ask this question. Nevertheless, if you people have any questions, you're more than welcome to answer your questions. You can put them in the chat box now or later. So the certificates are valid for 2 years, and you are taking the PLAB test. Your certificate must be valid on the day you set for the PLAB Part 1 exam. The proficiency level, Dr. Umar has already talked about it. So, but the total score should be 7.57 in each module. In the OET, which is the Occupation English Test, and the difference between the two is very simple. The level is almost, the challenge is almost the same, I would say. The only difference is that OET uses material more from the healthcare. So the doctors usually, whether they are students or postgraduates or any other, would prefer to take an OET rather than the IELTS because of the familiarity to the material, that is. So the bigger question is why Hive and what do we do? So we follow the international standard content. We follow a coaching model, not like teaching. It's not like teaching, it's preparing you to take the exam. So we sometimes, if required, locally, we can even arrange online, in-person classes also, but usually it's an online session. So anybody from anywhere in the world can join. And usually in my sessions, there's a good mix of people from all over the world. So there is an access to the course material, very selected course material. There is a one-to-one gap analysis that is done by me, myself, and my courses are very, very customized. They are not like typical course design, which I've created and I just go over it and people have to attend. No, my course is very, very much customized to each candidate and to each group. We take a lot mock tests so that we keep you abreast of where you are and where you are going and how much do you want to do to reach your required bands. There's always support and correspondence, the flexibility in the sessions according to timing and many other things. So it's a very, very customized course that is. There are discussion forums, there's WhatsApp groups, so we're always connected. On the whole, as you all know, there are these 4 tests to be passed: writing, speaking, reading, and listening. It's a one month course, 1 week focusing on each skill, but we do offer specialized skill-based courses too. So achieving systematic proficiency, I'm sorry, but this I need to pass on. So I only want to say that particularly, I want to reiterate myself and say, why would you want to join Hive? The major reason is that 2 or 3 things. One is that many academies have tutors, but they are not probably have been associated with the IELTS examining, so to speak. So I have been an IELTS examiner myself. I know the other side of the situation as well. So secondly, I've been an English language expert and teaching and training for almost more than 35 years in this field. Thousands of students, to my credit, which have been, alhamdulillah, they are good, well into their career and developed now. And the best thing is that it's a customized course, like I said. We will cater to whatever your needs are. And I'm very sure, I can assure you, that will be very happy if you join us. That was all from my side. If you believe in yourself, you'll succeed, definitely. So thank you very much for this time. Hive Academy, Dr. Umar, Dr. Shakil, and all the others available here. And we go on from here. I stopped sharing from here. If you have any questions, please put them in the chat, or otherwise, more than happy to answer. Thank you.
Thank you, Ma'am Noreen, as always, for sharing your experience, your wisdom, and we're indebted to you to have you on board. Right, guys, so as reiterated by Ms. Mirza, please do enter your questions into the chat box, and I can see that they are being entered, so that's great. We will take, we're keeping an eye on them, and we will continue to make sure that we are collecting the themes and the questions, and we will answer them. If it doesn't get answered throughout the presentation, then we will certainly do it at the end. Okay, so let's quickly go back to PLAB. So as we've already mentioned, there are 2 parts to the PLAB. PLAB 1 and PLAB 2. PLAB 1 is a written exam, and this tests the doctor's ability to apply their knowledge to the care of patients. So it's not just your ability to recall knowledge, it's your ability to apply knowledge. Now, lots of medical curriculums around the world are a little bit more focused, perhaps, to, or can we say, not yet focused on application of knowledge, but still focused on recall of knowledge. And so that's why you do need to make sure that you are aware of the requirements before attempting these exams. So it covers common, important, acute conditions, and it covers the management of long-term conditions seen in primary care. So that's PLAB 1. PLAB 2 is an OSCE exam. Everybody hopefully will be familiar with the term OSCE. If you haven't, it might be called something else, but essentially it's where you are, it's yourself, an examiner, and either a real patient or an actor who's playing a patient, and you are moving around a set of specific stations in the exam, and then you are testing out. What's being tested is your ability to communicate and to take a history or to examine, or all of the above. So all of the questions, of course, not just to PLAB 2, but PLAB 1 as well, they relate to current best practice, and these are best practice as published in the UK, of course, because it's a UK licensing exam. So PLAB 1, the written exam, multiple choice, or more accurately, it's actually a single best answer question exam, 180 questions, 3 hours, 1 minute per question. So each question starts with a short scenario followed by a short question, and then you pick the single best answer. And this can actually be, sometimes lots of the answers can seem the same, and you have to pick the one that seems most correct. Now, the good news is that for PLAB 1, so this is, I'm speaking specifically to our friends and colleagues on the webinar today who are not UK citizens. This can be sat in multiple international locations. I've tried to get onto the slide, the massive link for all the locations that you can sit the PLAB 1 at. But if you can't manage to take it from that rather poor attempt by myself, then you can just search in the GMC website or search in Google or any other search engine for PLAB 1 locations, and you will find them there. Just to let you know, just to keep you guys engaged and make sure you are awake after you've fallen asleep listening to me for an hour or so, we will have a few examples of single best answer questions for you to have a go at. Okay, PLAB 2. So PLAB 2 is the OSCE, remember. There are 18 scenarios, each lasting 8 minutes. You get a little bit of time to read the actual scenario before you go in. Very, very similar to medical school exams. Even I did something similar in 1837 when I graduated from medical school. You get 3 hours and 10 minutes to complete these 18 scenarios. You get 2 rest stations, allowing you to take breaks, and you get about 90 seconds to prepare for the particular scenario. This exam has to be sat in the UK, it has to be sat in the Manchester GMC Centre. So great news for anyone who fancies a trip and visiting the UK. Okay, just quickly, I'm going to mention pass rates. So it is not as easy as it may seem, and I don't say that to scare you at all. But I'm just letting you know that, as you can see on the screen, 2019 through to 2023, pass rates for PLAB 1 varied from as low as 63% to 74%, and for PLAB 2 to 62.9% to around about 70%. So there are unfortunately quite a few people who don't pass the PLAB exams. We'll chat a little bit about that later on. just to mention specifically from 2023, PLAB 1, 72% pass rate, PLAB 2, 62.9%. So I don't know whether you guys think that's high, low, okay, or whatever, but if you look at the actual numbers, tens of thousands of doctors sit these exams. 21,916 sat PLAB 1 in 2023, 15,781 passed, so roughly 6 to 7,000 didn't pass. PLAB 2, same again, 15,702, and less than 10,000 passed. So there are lots and lots of doctors, unfortunately, who don't pass these exams. Quickly, just going to mention what are the challenges in PLAB 1. Obviously, again, this might only apply for some of you, but it's worth just sharing with everybody. You have to ensure that you meet the eligibility criteria. Obviously, you have to do basic stuff like booking the seat for the exam. I'm sure lots of you you'll be doing that yourself. Preparation is most important, and any additional support required. Just briefly to mention them figures again, the passing figures, in our opinion, the reason why lots and lots of doctors and medical students don't pass their PLAB exams is because they think they can tackle them themselves, and they are not getting the support and the guidance from people who have examined before, have been through the process themselves, just like everybody involved on our team. PLAB 2 has its own challenges. There's things that you need to arrange the booking for the exam. You need to actually get to the UK. You need to prepare and practice. Lots of other support. Obviously, again, this doesn't apply for people who are UK citizens. You're just going to come home and live there and do it. But for people coming from outside, you might need accommodation. You might need transport. You might need lots of other support. And we will be there for you in them times. Okay. Just going to switch now to the UKMLA. And so as you will have figured out, although I hope you will have figured out, although the PLAB is sticking around, it's becoming compliant with the UKMLA content map and the UKMLA requirements as set by the GMC. However, for UK-based medical graduates, you will have to sit the UKMLA exam. So currently, everybody in medical school, whether you're abroad or in the UK, you all have finals, usually at the end of 5th year, but sometimes at the end of 4th year or at the end of 6th year, depending on the length of your course. Personally, I did them in my 4th year, so that was the penultimate year. So there are various different stages where you might sit them. How will the UKMLA be implemented? What does it actually mean? And what are the important dates? So we've mentioned the ones relevant to PLAB. So for the UKMLA, students graduating from UK medical schools for the year 24 to 25 will have to sit the UKMLA. Now, whether that means it solely whether it gets merged into the finals for your medical school, becomes a part of it, becomes the biggest part of it, is not, there's no hard and fast rule. Essentially what the GMC have done is they've set the requirements, and the medical schools themselves will be delivering the exams based on them requirements. Okay, so let's briefly speak about the MLA exams, and then we can compare and contrast the similarities to the PLAB. So AKT, or the Applied Knowledge Test, this is on-screen, multiple choice, 200 single best answer questions. And again, like the PLAB 1, it aims to assess your ability to apply medical knowledge to different scenarios. So very similar to PLAB 1, except it's 200 single best answer questions instead of 180. The CPSA, Clinical and Professional Skills Assessment. This is an OSCE type exam, like the PLAB 2, and it will involve scenarios that are realistic and that you might encounter as an FY1 doctor. Okay, so the question format of the AKT, very similar to the PLAB 1, single best answer, and it is essentially the same thing. You're given a scenario, then you're asked a question, and then you have 5 options, and then you have to pick which one you think is the best answer or the most correct answer out of these options. So, as I mentioned already, the requirements are set by the GMC and the Medical Schools Council of Assessment. And what they do is they then set the requirements, and then the medical schools individually themselves have to ensure that they comply. And obviously there'll be an inspection process and all that kind of thing. But that's not really for us to worry about. CPSA, again, the medical schools themselves will run the CPSA. The exact format will vary between medical schools because it's up to the medical school themselves to deliver, to put together and deliver these exams, but they all must meet the GMC standards. So I'm going to talk briefly now about the MLA content map. So this is essentially your syllabus, if you want to think of it like that. And this sets out the knowledge, skills, and behavior required to practice medicine in the UK. Now, these 3 terms are used across the board, whether it's in MLA, whether it's in PLAB, whether it's in the foundation program, whether it's in the GP training program. All of these things, these 3 terms in particular, they come from the GMC. So it's really good for you to get used to hearing them, knowing what they mean. But getting back to the MLA content map, is based on 3 key documents. You can have a look at these if you wish. The GMC's outcome for graduates. This sets the knowledge and skills you must possess as a newly qualified doctor from a UK medical school. The GMC's generic professional capabilities framework, and this sets out the capabilities needed for safe, effective, high quality medical care, to deliver high quality medical care. And also the third part is the UK Foundation Programme curriculum, which everybody who graduates from the UK and a lot of people who graduate from abroad will be relevant to, because you have to go through the foundation year program. The content map has 3 overarching themes: readiness for safe practice, managing uncertainty, and delivering patient-centered care. And again, these are 3 themes that you need to get used to. You may already be familiar with, depending on your medical school. But these are the 3 main overarching themes, and under these 3 themes are 6 main domains, and we'll have a look at these quickly now. So there are areas of clinical practice, whether it's surgery, medicine, mental health, pediatrics, whatever. You have patient presentations, which are of course related to areas of practice. So we've got examples here: breast lump, chronic rash, memory loss, multiple trauma, abdominal pain, etc., etc., etc. And then there are conditions which could, are asthma, diabetes, lymphoma, migraine, all of the things you need to know about as a UK medical graduate. So that's the areas of clinical practice. Then you have clinical and professional capabilities. You have to be able to assess and manage patients, assess and manage risk, be aware of safeguarding vulnerable patients, etc. And you have to be able to fulfill certain practical skills and procedures as per that document we mentioned earlier. And then finally, there are areas of professional knowledge, biomedical sciences, medical ethics, law, etc., etc. So it's really not worth me sharing the document because it is absolutely humongous. You can take a look at it yourself. It's freely available for you to see on the GMC website, as is the PLAB content map. I'll just briefly mention now the similarities and the difference between the 2, and we've had a look at both in detail. There isn't a lot, to summarize, there isn't a lot of difference between the 2. There are a few things in the MLA content map which are not in the PLAB content map, and vice versa, but the vast majority of the things are the same. Obviously, it makes sense. Whether you're coming out of a UK medical school or you are coming from abroad, everybody needs to meet the same requirements that the GMC have set to practice in the UK. And that is essentially the purpose of the UKMLA. Okay, so just to refresh again, because it can be confusing and sometimes it don't make sense. For the IMGs, International Medical Graduates, PLAB is continuing. It's becoming compliant with the UKMLA content map. PLAB 1, 8th of August, PLAB 2, 17th of May, and the PLAB content blueprint will be replaced by the MLA content map. Practical aspects for PLAB will not change, but for UK medical students, UK graduates, it is a totally new exam. So you might be sat there thinking, oh, what if I'm caught between the two systems? What do I do? Obviously, we've got a slide here that mentions lots of things depending on where you are in the PLAB process, what you need to do. If you pass both parts of the PLAB test, fantastic, well done to you. Get your GMC registration and let's help you get a job. Brilliant. If you pass PLAB 1 but not attempted PLAB 2 yet, or if you've attempted PLAB 1 or not passed it, or you passed PLAB 1 but not yet passed PLAB 2, you don't really need to worry. You don't need to do anything different. You still need to prepare. You still need to revise. You still need to do everything that you did before. Practically nothing will change. You'll still take PLAB 1 exam, the PLAB 2 exam, but they will, depending on if you do it after May or after August, etc., you'll be doing the exams based on the new UKMLA content map. Practically for you guys, nothing will feel different. Let's briefly mention costs. How much will the UKMLA cost? So the UKMLA, again, just to drill home this point specifically, currently it's still a special exam for UK medical students only. It's going to be free for you guys as it's part of your medical school courses and the medical school covers the cost. However, unfortunately, there are some people who don't pass it, the first time, etc. There may be resits, and the resits may have an associated cost. We're not sure yet. Essentially, it's up to your own medical school. And as I mentioned before, these will either be integrated with or sit alongside your actual final exams. Okay. For the IMGs who I still think are the majority of people on this webinar today, in terms of PLAB 1, PLAB 2, etc., IELTS, OET, all of that stuff is still there. All of the fees for that are still there, and none of that is changing, nor has it changed at the moment. So just moving forward and thinking about when you finish your medical studies, regardless of where you are, when you've passed your medical finals / UKMLA, or you have passed your PLAB 1, PLAB 2, will you have to complete foundation training? So the first thing to say is, obviously, if you are based in the UK, you're coming out of your UK medical school, you will have to go through the foundation training program. That is the requirements of the GMC. For everybody else who is studying medicine outside of the UK, it depends on, it's complicated, let's just put it that way. It depends on whether you have completed an internship, what is the equivalent of FY1 already. But we'll provide the link at the end. You can, or of course, we can approach us for advice. Eligibility checking occurs in July. Applications occur in September. Lots of you guys may or may not be aware of the SJT, which is the situational judgment test. This was something that was used to rank foundation program trainees. Lots of you will be happy knowing that the situational judgment test used to rank you is no longer used. Yay, happy days. However, now you will be ranked by an algorithm. Hold on, what? So before you were allowed to be ranked based on your own performance, now you will be ranked by some AI mechanism or algorithm thing. I'm not sure whether you guys feel happier about that, or I'm sure you probably do. There's one last test for you to do, one less test. Anyway, English requirements, just to briefly mention this, for the foundation program, versus registration for the GMC are different. This is confusing. It's confusing even for us to understand as to why this should be the case, but that is the reality. But don't worry about these kind of details. Obviously, when it comes to it, you know, there's lots and lots of things that we can do to advise you through that difficult time. Just to summarize, most IMGs apply for what are known as service jobs. That's just because they might feel that it's easier for them to get into that to get some experience and then enter training at a later stage, as a foundation program is competitive. But don't let that put you off. You do you, and we're here to help you do whatever you feel is best for your future career. The bottom line, again, as we will reiterate throughout, is no matter what your background, where you're coming from, what your situation, what your scores are, English scores, etc., just reach out to us for advice. What is the, whoops, skipped a few there. Okay, what is the ultimate goal of Hive, and what is the ultimate goal of CLAB and the UKMLA? Obviously, it's to get you a job in the NHS. That's why we guys are here, us guys are here. That's why we're here to help you through, to mentor you, to guide you, to train you. And we love doing that, and we love helping people on their career pathway. Very, very briefly, going to mention some benefits in the NHS. And I think this is important to mention. Number one, because the NHS gets a lot of bad press, let's be honest. You know, myself being being born and brought up in the UK, everybody else on this webinar, I am sure, who has ever been treated in the NHS or who has ever worked in the NHS will agree that it is a fantastic institution with absolutely outstanding individuals who do sterling work every single day to go beyond the call of duty to deliver free at the point of access care for the whole of the UK population. Bar none, it is still, in my opinion, even with all its issues, all its problems, and all the difficulties that you might see about in the media, it's still, in my opinion, the best state-based healthcare system in the world. That's just my plug for the NHS. Why wouldn't you want to work in it? There's lots of benefits. As you can see on the screen, annual leave, living and housing options, help to buy houses. If you're into cars, like me, there's lots of schemes for you to get cars as well, flexible working practices, NHS discounts, lots of other schemes. And the NHS pension service, the pension scheme, which is one of the best pension schemes in the world, non-private pension schemes in the world, where you get a tax-free lump sum, you get, you know, there's lots of other things as well. So fantastic place to work. Had a great 15 years in the NHS, and I'm really excited and hopeful that lots and lots of you people in this webinar today, if you're not already, will be future NHS doctors. Now it's time for me to have a bit of water, have pause, and hand over to our fantastic colleague, Dr. Ibifunki. I'm just going to briefly mention her background, just so you know who she is. So Dr. Ibifunki is a graduate from Ghana. She's an international medical graduate, so she will be able to relate to a lot of you on this webinar today. Obviously, she came to the UK through the PLAB system. She's working in the NHS, and she is an ST4 in surgical training. So she's in higher surgical training. She's specialty training 4, so she's well on her way to becoming an NHS surgeon. Just a little plug for her. She's done fantastic work already through her own platforms on helping international medical graduates based on her own experience. And she's just going to mention quickly about the things that are available for all of you guys when, not if, when you successfully complete all of your medical school exams and your PLAB or UKMLA exams, and you start working in this fantastic institution, which is the NHS. Okay, that's enough from me. I'm going to hand you over to Dr. Ibifunke, who's going to just share with you a few things about what kind of support we can offer at Hive for CPD, and then I'll come back in a bit.
Thank you for having me. My name is Ibifunke, as Dr. Umar said. Hello, everyone. I hope you're enjoying the meeting so far. So Dr. Umar has talked about the process for joining. For most people, the approach to getting GMC registration will be PLAB or UKMLA, for which you'll have to do your English exams. But there's a popular slang called PLAB 3, which is the phase where lots of people are trying to find jobs. And we know that it has become increasingly difficult for IMGs once they've got their registration to get into the UK. That said, there are other routes to get in, like membership exams of the colleges. I know that lots of IMGs find all the terminology difficult to understand. But for more senior people in their careers, you can choose to avoid PLAB and go for membership exams, since you'll still need them to progress anyway. So I'll talk about how working with Hive, we can help you through your career. And the beauty of Hive is that you go on a journey from when you get your GMC license, and you have support throughout your career. So the first thing, once you've passed your exam, you've gotten your GMC registration, would be support to apply for jobs. So there's specific ways that you can apply for jobs that give you a higher chance of getting shortlisted for interviews. Once you get shortlisted, there's specific ways to perform in the interviews to give you a higher chance of being selected for the job. Through the Hive Medical Academy, you'll have access to some tutoring on how to perform, how to apply for the specific jobs you're interested in, and how to go about getting or performing during your interview to get the job. Once you've got the job, you then have to think about how you cope at work, how you stand out, how you interact with people, how you progress in your career. So there'll be tips and guidance on things like that. So even things as simple as how to call for help. You're calling from one department to a different department. How do you make sure that that call goes your way and you don't get some of the experiences that people have? When you're starting the job, how do you ensure that you put your best foot forward? So there'll be guidance for things like that. For your GMC portfolio, lots of people come and you hear IMGs saying things like, I didn't know I had to do an appraisal in my first year. And those are all really pitfalls that can be avoided. There's no reason why an IMG joining shouldn't know about the portfolio. There's no reason why you should miss out on getting your appraisal in the first year, so you can get feedback about your performance and you can develop a plan for your next year. So we have some guidance on how to prepare your portfolio in order to make the best of it. In the NHS, whether you're working in training or in a non-training role, because some people join the system straight into training programs, you're going to need to participate in audits and quality improvement projects. So there'll be support on how to carry out an audit. What is even an audit? What is a quality improvement project? How do you get involved? How do you get these things published? How do you make the most of it? If you're planning to apply for training, how do you prepare your portfolio? What is a portfolio? What are the efforts that you have to make? So these are the kinds of guidance that will be with you throughout your career once you join the UK and you work with Hive Medical Academy. And last but not the least, I've got a copy of my book, which is called Thriving in the NHS. And this book is based on my experiences. When I joined in the UK, I didn't expect that I would struggle because I had lived here as a postgraduate student before, but I hadn't worked in the NHS at that time. So it was a completely new experience and it was quite challenging. And what I learned from my experience was that there were lots of things that if I had known and understood, I wouldn't have had any of the trouble that I did. So this book is a guide for anyone who's starting in the NHS to understand what to expect, to understand the system, and to make the most of it. It's available discounted to every person who accesses courses or other materials through Hive Medical Academy. So that's in a nutshell the kind of continuing development that you'll have once you've completed your licensing exams and you've got your GMC registration. In partnership with Hive, I'll be providing some of these services. So thank you for listening, and I'm sure if there are any questions, they'll be answered at the end.
Thanks so much, Dr. Ibifunke. Really looking forward to helping all our friends on the webinar today once they've passed that PLAB and UKMLA journey. So thanks for that. I'm just going to very, very briefly just hand over to Michelle just to mention something that's something special for you guys that's only available today. And then after that, you guys will need to do some work and a bit of revision, preparing you for your PLAB and UKMLA exams. We've got a few example questions for you guys to try out and get an idea of what they like, and we can work through them together after that, after this short message.
Okay, hi guys. So quickly then, obviously, as you know, at Hive Academy, we have various courses and services that we offer. You guys are mostly interested in PLAB and PLAB 2 courses. So what we have today, we've got some discounted offers on the PLAB 1 and PLAB 2 courses. If you're wanting to get ahead and have all the support that you want to try and pass these courses, and hopefully first time, we have a lot of past students who've passed these courses first time, so we know it works. So the PLAB 1, very quickly, the PLAB 1 course, it includes 24/7 access to your course tutors via WhatsApp. You get 3 live UKMLA PLAB 1 teaching sessions. You have a complete video course as well as an audio course. You also get 10 mock exams and loads and loads of MCQs of the latest ones. You also get 250 digital flashcards as well from Rapid Revision. So that course is 10% off today if you're interested in the PLAB 1 course. So that's going for 180 today. The PLAB 2 course. So this one, a lot of you I think are interested in doing the PLAB 2 course. And that includes an intense 10-day face-to-face teaching program. It also has the SimMan and Mannequin teaching and practice, a PLAB 2 online video course. You also have 2 PLAB 2 mock exam sessions, which are booked whenever it suits you as per your exam date. 2 PLAB 2 audio courses and data gathering flashcards, medical explanation flashcards and examination and procedure flashcards, practical video course and explanation flashcards, and an online practice case bank as well. These are the most comprehensive all-in-one packages that we have. Really focuses on your knowledge and your exam techniques. And as I said, so many past students have passed these exams and a lot of them have passed first time, so we know it works. And the PLAB 2 course is on a discount today for £750, and that's actually saving you £250 as well. And also, you don't need to worry if your exam's not next week or next month. You can get these packages today because they'll still be valid in a year's time, 2 years' time. Whenever your exam is due, then it will be valid then as well. So it doesn't have to be valid for right now. So that's the courses that we have on offer today. We'll also pop the information in the chat box for you as well.
Thanks so much, Michelle. Thank you, Dr. Ibifunke, again. So just to reiterate, you can get these packages through our website. This offer is only available today, so please visit the website afterwards. Okay, let's move on. All right, so time for you guys to do a bit of work now. So we've done this lots and lots of times before. I'm going to just quickly read out the question. This is an example of a MCQ, which is a single best answer question. And this is applicable to both the UKMLA and the PLAB, because of course, as a doctor, either graduating from a UK medical school or from one abroad, you will need to manage people with diabetes, and you'll need to know about the guidance for diabetes in the UK. Okay, so let's crack on. We've done this lots of times before. Enter your answer into the chat box. And we'll see what people think. Okay, so you review a 43-year-old man with a history of polyuria, polydipsia, and weight loss. You suspect a diagnosis of type 2 diabetes. What is the single result that is most consistent with a diagnosis of diabetes mellitus? A, random plasma glucose of 10.5. B, fasting plasma glucose of 6.5. These are all millimoles per liter, as you can see. 2-hour OGTT glucose concentration. of 7.5 millimoles per liter, HbA1c of 50 millimoles per mole, or a HbA1c of 6.2%. So let's have a look. Okay, so thanks to everyone who's answered in the chat box. A few people said B, 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 B. Lots of people said B. Somebody said E. A couple of people said E, and somebody said D. Okay, another B. Any more for any more? Before we B again? Okay, brilliant. Fantastic. Right, let's have a look at the answer. Another B's. Okay, so the correct answer is D. So well done to Bara. Sorry, that's what your name comes up as. I'm not sure what your full name is. Fantastic. Well done to you. Commiserations, everyone else. I'll just briefly explain why that question, the correct answer is D. So let's just go back to the question. As you can see, there are a few different methods of testing for diabetes mentioned here. There's random plasma glucose, there's fasting plasma glucose, there's a 2-hour OGT test, OGT test, whichever one's right, and a HbA1c, as well as in millimoles per mole, as well as a percentage point. Okay, so why is D correct? Well, let's have a look. So this is because, according to the 2011 WHO recommendations, HbA1c is now used as a diagnostic test in the UK and is pretty ubiquitous. It's used everywhere. That's not to. That doesn't mean that millimoles. Random plasma glucose or a fasting plasma glucose cannot be used. But generally speaking, it's HbA1c that is used, and in the UK, that has to be 48 millimoles per mole or above. And OGTT is used as well, but mainly in pregnancy. Is used in a few other scenarios. But the basic point being that actually the only one that was diagnostic of diabetes in that actual list was the HbA1c of 50. Now, there are lots of people who answered B. I can see why, because it is, maybe you got the criteria confused, or maybe it's because you use different units based on where you've studied. This is the key point about PLAB and UKMLA. All these questions are going to be based on UK guidance. And obviously, you need to make sure that you are well aware of these. Okay, so that was the first question. Just to briefly make it clear, if it wasn't already, random plasma glucose of 10.5 isn't diagnostic with diabetes. It needs to be above 11 or 11.1 actually. Fasting plasma glucose 6.5 isn't diagnostic in millimoles per liter. That needs to be above 7 or 7.1. And HbA1c of 6.2% also isn't diagnostic. Okay, let's move on to the second question. So, 60-year-old woman is reviewed 3 days after an MI. She states that she feels very breathless. On examination, she has a pansystolic murmur, which is loudest at the lower left sternal edge. What is the single most likely diagnosis for this lady? As before, please hazard your answers in the chat box. Be brave, don't worry. This is quite a difficult one, I have to admit. Nobody wants to have a guess. 60-year-old lady, she had an MI 3 days ago. She's breathless and she has a pansystolic murmur. Thank you, Liba or Dr. Liba. She answered A. Julia answered C. Another person answered A. Fantastic. Thanks, guys. C, C, C. Okay. Brilliant. Let's take a look. Another A, mitral regurg. Let's take a look at the answer. Another A. Okay. The answer is C, ventricular septal defect. So well done to everyone for having a go, and especially well done to those who answered C. So let's go back to the question. Key bits of information. This is what you need to, these kind of things you need to be aware of. It's 3 days post MI, she's breathless and pansystolic murmur. So obviously, ventricular septal defect can occur post MI. It's very serious. It's quite rare, but it can happen. Can result in cardiac wall rupture. It does tend to develop around about 3 days after the MI, and it's quite bad in terms of mortality rate, etc. But why is this one specifically? Why is this one the correct answer and the other one isn't? Does anybody want to have a go at explaining? If you do, that's okay. If not, no worries. Okay, I can't see or hear anyone. I don't know if anyone is allowed to unmute, but never mind. We'll just carry on. So, mitral regurg can cause a pansystolic murmur as well. But it's heard usually at the apex, radiates to the axilla. Tricuspid stenosis can cause an early diastolic murmur, which is heard left lower sternal edge. Mitral stenosis causing a rumbling mid-diastolic murmur. So out of all the options that were mentioned, the most correct one is ventricular septal defect. Okay, let's move on to the next question. So, 76-year-old woman, poorly controlled hypertension, develops sudden visual loss in her right eye. Visual acuity in the right eye is reduced to hand movements only. Visual acuity on the left is 6 out of 6. On examination of her fundi, so you have a look at the back of her eyes, note engorgement of the retinal veins, disc edema, multiple flame-shaped hemorrhages and cotton wool spots spread across the entire retina. What is the single most likely diagnosis? Options are central retinal vein occlusion, vitreous hemorrhage, central retinal artery occlusion, diabetic maculopathy, or wet age-related macular degeneration. Thank you, Jawad, for getting in there first. Answer D. What do other people think? A, B, C, D, or E? Another person thinks D, D. Lots of people think D. Okay. Anyone think anything else? A, retinal vein occlusion. E as well, wet age-related macular degeneration. Give you another 30 seconds or so. E again. Okay. So a mixture of answers there. Let's have a look at what the correct answer is. The correct answer is A, which is retinal vein occlusion, central retinal vein occlusion. So well done to whoever answered A. Fantastic. Well done. So let's have a look at why that is the case. The first thing I want to do actually is I want to point you to the question, and this just illustrates why exam technique is really important. So you have a 76-year-old woman. She's elderly, poorly controlled, hypertensive. The key bit in the question is she develops sudden visual loss in her right eye. Sudden visual loss. So that should tell you straight away to think about which of these options would not give you sudden visual loss. So for the people who answered diabetic maculopathy, generally speaking, remember it's generally speaking, of course it can occur in certain situations, but generally speaking, would that present with sudden visual loss? No. Wet age-related macular degeneration, would that present with sudden visual loss? No, that would usually be gradual. Then you're left with 3 options: retinal vein occlusion, retinal artery occlusion, or vitreous hemorrhage. Vitreous hemorrhage, what does vitreous hemorrhage present with? That presents with, it depends on how big the hemorrhage is, of course, but generally present with debris in the vitreous, some floaters or something else coming across the vision. That leaves you with 2, retinal vein occlusion or retinal artery occlusion. So this is where the knowledge bit comes in. You have to know what the appearance is of each. And in central retinal vein occlusion, this is described as being likened to a pizza being thrown against a wall, where you have engorgement of the retinal veins, discodema, multiple flame-shaped hemorrhages, as well as some other things as well. Obviously, hypertensive changes, some could be similar, but in retinal vein occlusion, that is what you get. So that's just a demonstration of how to kind of whittle down your answers and then arrive at the correct answer. You need a bit of knowledge and a bit of exam technique as well. Okay, let's move on to the next question. 62-year-old female smoker, don't worry, there's not many left now. 62-year-old female smoker presents with weight loss, dysphagia, intermittent vomiting. On examination, you note a mass in the left iliac fossa and also palpate a fullness in the right iliac fossa. Ultrasound scan demonstrates bilateral solid ovarian masses with clear, well-defined margins. What is the most likely underlying diagnosis? Again, really typical question, PLAB and UKMLA, exactly the same format. This is how they come. What do you think the answer is? So the options are primary ovarian carcinoma, esophageal carcinoma, gastric carcinoma, benign ovarian tumor, or functional ovarian cysts. Thank you, Hepzibah, for being the first one. You've answered D. What does everybody else think? Please post your answers. I'm trying to see how many people are still on the webinar. I'm guessing there's still quite a few. 66 people. Come on, guys. Don't be shy. It's not a real exam. D, D, A, D. Lots of Ds, lots of As. Okay. You can see a theme emerging here. Keep going. Any other guesses? A again. Okay. A. Okay. All right. So all A's or D's. Okay. Let's have a look at the answer. Answer is C, gastric carcinoma. So you might be feeling a bit confused right now. Don't worry, I totally understand. Difficult question, distracting information in the blurb right at the beginning. Let's have a look at re-look at the question. Let's see how we could have handled that a bit better. So you've got a 62-year-old female, okay? She's a smoker. What are her key symptoms? These are the parts of the information that you cannot miss out. So she's got weight loss, she's got dysphagia, and she's got intermittent vomiting. Now, if we had a question where it presented to you a 62-year-old lady, she's a smoker, she's got weight loss, she's got dysphagia, and she's got intermittent vomiting, what would you think is going on? I am sure that the vast majority of you would think about some kind of upper GI tumor. Yes or no? I'm sure the answer is yes. Okay, now, later on in the question, it says you note a mass in the left iliac fossa and palpate a fullness. Ultrasound scan demonstrates solid ovarian masses, clear, well-defined margins. Let's just bear that in mind. But there's some information. It is obviously all relevant, but it is also distracting as well from the key features. So the answer is gastric carcinoma. This is a type of metastases from the stomach, which are called Krukenberg tumors. Okay, so these are ovarian tumors that have metastasized from a primary site. And the primary site here is, of course, the stomach, the gastric mucosa, and obviously, as we mentioned at the beginning, if you focus on the key bits right at the beginning of the question, try not to get distracted, you will actually realize this looks like an upper GI presentation, and then obviously you will have to use a bit of knowledge to determine or to remember that these can metastasize in certain situations to the ovaries. Okay, so again, important to think about exam technique. What are you focusing on? And this, you'll be pleased to know, I'm sure, is the final question. So let's give this a go. This should be hopefully much more straightforward. 44-year-old businessman returns from a trip to West Africa with headaches and intermittent fevers. Thick and thin blood films are sent to the lab and a diagnosis of malaria is made. Patient is started on treatment, but his condition deteriorates and he develops jaundice, renal failure, and hemoglobinuria. What is the single most likely causative organism? Okay, so what does everybody think? 44-year-old man, been to West Africa, headaches, fevers, and he's had a diagnosis of malaria. What is the most likely causative organism out of the ones that I mentioned? A couple of people said D. Anybody else? Somebody said C or A. Okay, that's great, but you've got to pick one. B, A, C. Okay, thank you. No worries. Don't need to apologize. C, A. Okay, so a mixture again, mostly A or C and some D's as well. So let's have a look at the answer. Correct answer is A, Plasmodium falciparum. So why Plasmodium falciparum and why not the others? Okay, so just going to take you back to the question, get you to try and get into that mode of focusing on, perhaps even highlighting, if you can't physically in your head, what are the key bits of information. So West Africa, okay, 44 years old. He's got symptoms of malaria. He's got diagnosis of malaria. But look at this second part of the information. He develops jaundice, renal failure, and hemoglobinuria. Okay, so if you didn't have a clue, obviously you would have to guess, and you've got a 1 out of 5 chance, which is not great of getting the correct answer. So obviously the better thing to do is to make sure you're well prepared according to the what will now be the UKMLA content map for either your PLAB or your UKMLA exams. Going back to the answer specifically, there are 5 species recognized, and these are the 5 that I mentioned: Falciparum, Ovalia, Vivax, malaria, etc. But the classic symptoms are there, and the particular key bit of information for this one is that hemoglobinuria and renal failure is suggestive of something called black water fever, which is caused by Plasmodium falciparum. So again, you can see that you have to, and these are the key bits of information that I want you guys to take away from these example questions, is that number 1, obviously you do need knowledge as well. So knowledge can be gained from, well, I was going to say books. I don't know how many people use books these days, but it can be gained from all the resources. It can be gained from being taught. However, your ability to apply the knowledge is also just as important. And for that, you need a bit of coaching on exam technique, as well as ensuring that you are preparing for your exams from information that is correct, up to date, based on UK guidelines and in line with the UKMLA content map. And we do all of that for you at Hive. Okay, that's enough work for you. Quite a lot of work for me done as well. I'm just going to put this up on the screen. Examples of questions. Obviously, we've got lots in the chat. You might have questions about when should you apply, how should you prepare, what research should you need, should you join an academy or do it alone, how are you going to get a visa, if you need one, how are you going to book a ticket. Most people probably won't answer that, need that question. Where will I live? Some people might need to know the answer to that. How will I commute to and from the academy or from the examination center? Who will help me get a job? How do I ensure I am ready to work in the UK? Okay, lots and lots of potential questions. If you haven't thought of these already, you should do. These are the type of questions you should be prepared for, you should be asking. And obviously us here at Hive, we can help you with all of these areas. Personally, as I've mentioned a couple of times already, that we've mentioned it when we were talking about pass rates. Obviously, some of my colleagues mentioned it earlier. I mentioned it also when I was going through the questions, that resources, preparing content, that's all really important. It's quite difficult to do on your own, especially if you are you know, you're studying in an institution that is not in the UK, they're not going to be teaching you. Obviously, medicine is the same, granted, correct, but the application of medicine is different. The guidelines are different, the drugs are different, all the protocols, etc., are different. Has to be based on UK content. Have to be, in our opinion, taught. When you go to medical school, obviously you get taught. Generally speaking, you don't do DIY medicine, not most places anyway. So you need to be taught by people who know what they're doing, and all these other things that we've mentioned about support on all the other issues that are relevant in relation to moving to and working to the UK. We can help you with all of that. Very briefly, I'm just going to illustrate a quick timeline of how quickly you can do all of this stuff, and then we will close and we will have some questions and answers, and we will go through. I've already been going through the chat boxes. We can see the themes, but we'll give you a chance specifically to come on the mic and ask your question. Dr. Skill, our CEO, was IMG himself, founder of Hive. He's around. He's on the webinar, and he has much more experience than me in terms of PLAB, because he actually sat PLAB. I didn't sit PLAB. I was a UK graduate. So he will be available also to answer lots of these questions. Okay, let's move on. So your journey to the UK, just to remind you, you have to be eligible for PLAB. And part of that eligibility includes English, IELTS, OET. That should be in step 1, then pass PLAB 1, pass PLAB 2, be ready for the NHS, and then start working. So obviously, in relation to UKMLA, if you are based in a UK medical school, you have to pass your UKMLA in the final year or your final exams, and then be ready to start working in the NHS. So based on our years and years and years of experience, we think that this can be done in total in 10 months. If you need any help with IELTS OET, which lots of people may do because English is not their first language, even if English is your first language and you are a citizen of the UK, you still need to know about the exam, what it tests, what it looks for. If I was sitting IELTS and OET, I would also need to know what is the exam going to test, even though English is my first language. So IELTS OET, that can be done in 1 to 2 months. Preparation for PLAB 1, or of course UKMLA AKT, that can be done in 3 to 4 months. PLAB 2, including coming to the UK and actually doing your preparation while you are here. And of course, for UKMLA, relevant people, that can be done in 2 to 3 months. This is a whole course where you have your in-person training, SIMMAN, mannequins, coaching on history taking, examination, and all of the things that are relevant to that syllabus. And then we keep mentioning this because most academies, most institutions, they will help you pass your PLAB exams or UKMLA exams, and then they forget about you afterwards, or they leave you to yourself. So we know, Dr. Skill knows, hundreds and hundreds of doctors who passed their PLAB but were unable to get a job in the UK. And this is where Hive is different, and we will not leave you alone until we have made sure that we have secured a job for you in the NHS, and that part can take 1 to 2 months as well. Okay, so in summary, what you guys need to do is you need to focus on your studies, do the studying part, and let us help you with that part as well, and we'll handle the rest. Just to let you know, everything we've shared today is directly from the 3 most important resources. Nothing we've made up ourselves, at least in terms of the information on UKMLA and PLAB. It's all from the GMC, Medical Schools Council, and the Foundation Programme information on the website. Just briefly going to mention this again for a final time. PLAB 1 premium package, one-off offer only for today. And you can only avail this today through the website, and our even more special offer of PLAB 1 and PLAB 2 Premium put together, also available today. The links are in the chat box. Thank you very much for listening to me and putting up with me, and to listening to the rest of the team. Now, I'm gonna hand back to Michelle. Just to, I will be on call on hand to help as well. Dr. Keel is here. Ma'am Noreen, I'm not sure if she's still here or not. If she is, she will help out if there are any IELTS related, OET related questions. But we need to
I am
give
there, Dr.
everybody
Umar.
the opportunity to be able to unmute and ask their questions through the mic if they want. Sana, if you could please make sure that people can unmute themselves, or if we can use the put the hand up function, that might be better. So I'm going to hand over the management of that to other people. Thank you, Ma'am Noreen. Thanks for being here. Okay. Right. Over to you guys.
Thank you very much, Juma. You can rest your voice. Well, maybe not if you're answering questions. Yeah, thank you very much, everybody who's still on the call on the Zoom. That's great. Still quite a few of you on here, so that's brilliant. Yeah, so basically, anyone who has any questions, we're going to go through them. I don't know if someone else wants to take over reading certain questions from the chat or asking people what the questions are. But I can start off with anyone I can see someone's raised a hand. So Jawad, if you want to unmute yourself, then you can always ask your question because your hand is up.
Thank you very much for your presentation. I wanted to ask, I'm a non-EU student, but I study in the EU. I study in Bulgaria. So I wanted to ask to make sure, am I going to set the PLAB or the UKMLA? And if it is the UKMLA, am I going to sit it during 4th year or after I graduate, just like the PLAB?
Thank you so much, Jawad. It will be once you have done your degree, and it will be MLA, but when the GMC changed the name. So now from August, part 2, part 1, they have changed to MLA for the local graduates. But for overseas graduates, it will be there will be slow transition from PLAB to UKMLA. The content will be matched with the MLA content, but the name will be still same. That GMC will change PLAB name to MLA name slowly. So first you need to complete your degree, if it is your 5-year degree, and after that, if you have got the internship, well and good. If not, after that, you need to pass your English exam, either IELTS or OET, then you could apply for your part 1, PLAB 1 or AKT 1, AKT. That's the MLA part 1. I think in the chat box, there were a few other questions. People were confused about whether they have to, if they have done GCSE from the UK and they have done A-level from the UK, do they still have to take exam or not? So I will just explain these things. We have got quite few number of graduates who are British citizens. They've done all education, primary, secondary education from the UK. They graduated from the European countries, and they have back here, they had to take IELTS exam, and they had to, before May, they didn't need to take that PLAB. But now, once the MLA is implemented, they had to take these exams. So all the graduates, especially after the Brexit, you have to take your English exam. If your graduation is outside the UK, you're coming back and you want to practice in the UK, it is very clearly on the GMC website and foundation website that you have to pass your English exam, unless you provide some evidence that you have got the equivalent qualification with IELTS or OET. For majority of the students who are coming, who are even the British citizens, they have education in the UK, they have to follow all these steps. First step is the IELTS, OET, then the PLAB 1 and PLAB 2, then they get the GMC registration, they start working. Another question was people who are struggling to get the job in the UK. I have seen some messages that they have graduated from Sofia, Florida for one university, and they're back here for 12 months and they're not getting the job. So there are a few things, you know, when you are like myself, I was an international medical graduate. I came from different country, came here. So most important things, you need to understand the NHS system. You need to know how the NHS system works, because your placement during the placement attachment during final year, 4th year, that's in completely different country. So once you are here, you need to know, you need to understand. And for that, you need to get the attachment. And once you get the attachment, you need to involve with the GPs or hospitals Another thing, your CV should be standard of NHS. So once you have done these things, then you could apply for the job on the job portals and you could get the job. So what we do at Hive, all our candidates who are coming, we provide guaranteed clinical attachment. We review their CV, we review their gap analysis, we do all those things, we prepare them for the interview, we do the mock interviews, and probably your chances are better to get the job. Like your standard become equivalent to the local graduates. So it's very important, once you have done the graduation, you're coming back to apply for the job, get the guidance, get the support. So you're not wasting some time because, if you're graduating from different outside the country, like especially in European, like you're already spending 5, 6 years, 6.5 years there, and coming back into the UK, you have to wait for a couple of years. It's not good. So rather than wasting time, get the professional advice, get your things done, get on track, and get the job, and get in the system.
I just want to pick up on the questions as well that were asked a bit earlier, and just because there still might be some confusion, whether who needs to sit which exam. So just to reiterate again, if you are a UK medical student attending a medical school in the UK, you will be sitting the exam called the UKMLA. If you are studying medicine anywhere outside of the UK, apart from very few select places, I think Sweden is one of them. There might be one or two more. That's the only one I know off the top of my head. If you are studying outside of the UK, or you're going to graduate from a medical school outside of the UK, whether it's in the EU or whether it's in Asia, etc., you will currently still be sitting the PLAB, Part 1, Part 2, as it is now, but it will be based on the same content as the UKMLA content map, which is used for the UK graduates. So still a separate distinction, international medical graduates, PLAB, but now it's compliant with UKMLA, UK graduates sitting UKMLA.
So about getting the internship at what stage. For international medical graduates, once obviously if they're not British national, they will be coming back to UK after when they take the PLAB 2. So once you apply for the PLAB 2 and you have got the date, you have taken your exam, there are 2 weeks wait from PLAB 2 to get the results. So those 2 weeks are very crucial for the international medical graduates. You try to do the attachment within those 2 weeks, get your CV done, prepare your mock interviews, get ready for the job. So soon you pass your exam and you're ready, you get the GMC registration ready to apply for the jobs. For the British citizens who are coming back to the UK, there are the opportunities. Once the fourth year final year, if you contact us, we could arrange your placements and different GP surgeries or hospitals where you will get the orientation to the NHS. So you will be well aware of the guidelines, NHS system. So it will be easy for you once you've done your graduation and coming back. Most of the work will be done and you'll be ready for the job. So if you need, once you're fourth year, final year medical student in anywhere in Europe, you're coming back on holidays, or the summer holidays or winter holidays, whenever you're coming back, contact us and we'll help you to get the placement. There's a question about difference Alsinoity. Ma'am Noreen, it's over to you if you want to answer that question about Alsinoity.
Yes, thank you, Dr. Shakil. Yeah, there was a question about it. So very briefly, both the tests test the same 4 skills: reading, writing, listening, and speaking. But like I said earlier as well, that many times the medical students and the medical professionals, they want to opt for OET. The difference is that the material used to test in an OET is all from the healthcare field. For example, in the writing of IELTS, you have to write an essay, and the topic of the essay can come from economics to government to geography to any subject in the world. But in an OET English writing tests, you have to write a letter of recommendation or letter of transfer or something like that, which is a usual thing that doctors usually do. Similarly, in the speaking part, the speaking question in the IELTS can be from anywhere in any topic you can think about. But in the OET English speaking test, you need to speak to a patient or a parent, a carer. So similarly, in reading and listening, the input material that's given to you in listening and reading in the OET is from the healthcare field. So that is why, briefly answering your question, if anybody has that the mostly the medical students, professionals from the healthcare, doctors, they prefer to opt for an OET because the material is familiar to them and the situations are more familiar to them. So that is the one reason. Otherwise, the difficulty level of IELTS academic and OET is almost the same. I hope that answers your question. Over to you, Dr. Shakil.
Thank you so much. Thank you so much. There's another question. Someone says, I will be graduating from Bulgaria 2026. Do I have to sit UKMLA? Yes, definitely you have to. Maybe if it has, the name has been changed in that, it will be UKMLA, definitely, UTT part 1 or 2, but it will be PLAB. But at the moment, it's MLA for the local graduates and PLAB for anybody outside the UK graduate.
There's another question. Guys, do feel free to put your hand up. I don't think anyone has put their hand up, and come on the mic if you want to. I'm just trying to go through and similar questions, obviously, that I think should be answered. Specific ones. There's somebody said, I'm a UK citizen, graduated from Bulgaria in December 2023. I've completed 2 clinical attachments, but still haven't secured a job. Many others in my year are in a similar predicament. I'm hearing this year there's a lot more IMGs plus changes in PA regulations. Do you have any tips to increase the chances of securing our first NHS job, Dr. Shakil?
Thank you so much. Yes, definitely. I would request on them just in touch with us. There will be something missing because still there is a shortage of the doctors. So if you are not securing any job in the NHS, there will be something. So we need to have a detailed discussion. We need to review your CV. We need to know where you did the attachment or what you did exactly. What was it? Just shadowing somebody, and did you do something? If you have the GMC registration and still you're not getting job, this is again worrying. So we need to have a discussion with you guys, and we can go through, everything, all your documentations, all your CV, and your interview skills, your communication skills about the latest hot topics about the NHS and how your interview went. So please get in touch with us, and we will do our best to get you a job.
Thank you, Dr. Hill. Just looking at some of the earlier messages we might have been missed. When should we start PLAB 1 and PLAB 2? Somebody asked that around about 4 p.m. I think they mean when should we start preparing for PLAB 1 and PLAB 2? Dr. Hill, again, I think you're probably best to answer that.
But I would strongly recommend when you're in final year, start preparing for the PLAB 1 and PLAB 2. Don't your English test done when you're in final year, because your PLAB 1 and PLAB 2, or there are MLA there, contains most like your final year knowledge. So your knowledge will be flat when you're taking your final year exams. Your knowledge will be fresh, and it will be very easy for you to pass your PLAB 1. Because PLAB 1 mainly they're assessing your knowledge. And if you're doing your OSCE as well in final year, PLAB 2 or CPSA would be like OSCE. So start preparing for your exams, PLAB, if you want to. That's the best thing is to in the final year, get your English test done, get your PLAB 1 once you're in final year. After that, you can do your PLAB 2 and start applying for the jobs. That's the best way to save the time.
So GA raised their hand, so please unmute yourself and ask your question.
Hi, I would like to find out, because I'm in year 1, is it worth paying for the, for Hive today, or should I wait close to the time that I'm graduating?
So you are in first year MBBS, medicine.
Yeah, I'm in Plovdiv. I'm in first year in Plovdiv in Bulgaria.
Yeah, you're in first year, but the same that once you come back, like during 3rd year, 4th year, if you're from the UK, when you're coming to the UK, get in touch with us. We will arrange some attachment for you. So you will be well familiar with are you 4th year or first year? Sorry, I missed it. You 4th year. First year, yeah. First is too early for you, but it's better stay in touch. When you reach to 3rd year, 4th year, then you could, we could, once you're back in the UK, we could arrange some attachment for you here. And once you're in final year, we'll help you to start preparing for your English class and PLAB 1 and PLAB 2.
Okay,
sorry, I think that some of the sound isn't clear. I heard 4th year and Dr. Shakil heard first year.
One.
Oh, 1. Okay,
Yeah.
that's fine. Yeah, so that's already been answered. A bit too early, but never too early to start preparing. So certainly do start having a look at all the processes, understanding what you need to do, etc.
Okay, but I shouldn't pay yet. I should wait until year 4 before making any payments?
Yes,
Before
surely,
registering
because
with you guys?
our special offer is, if somebody wants to take exam within 24 months, they have to pay what's the price we are offering today. Because this is a special offer. Even after 24 months, the prices will go up, but they will paying the same price which are today, which is almost nothing. Because normally the charges are very high for the Flap 1 and Flap 2. And if you first year, you go 4 years, and then so you
Yeah.
want us to freeze price for 4 years for you.
Okay.
Yeah, so it's a maximum
Oh, so are you saying
20.
that I could pay now and then I don't have to pay anything when I'm in my 4th year?
Yeah,
Or I
we
should
could do that for
wait?
you. Yeah, we could do that for you.
Oh, okay.
Yes, yes,
Thank you.
yes.
Thank you. Thank you,
No
sir.
worries, no worries, no
Bye,
worries.
sir.
Just get in touch. Okay.
Thank you, sir.
Dr. Keel, just want to pick up on some again. So can Hive help us find clinical attachments while still in medical school? So I think that's similar to what you've already said, but please, yeah.
Definitely, I think it's very important, especially for the UK citizens who are studying in the European countries. Whenever you're coming back, you're in third year, fourth year, or final year, when you're coming back to home and you're on holidays, you must do some attachment. This is very important. You will get to know the system. You will get to know the doctors working here, junior doctors. So just get in touch with us and we'll arrange everything for you. We are the only academy in the UK providing guaranteed clinical attachment and full support even after passing your exams and everything and getting your job. So please just get in touch and we'll do everything for you.
I don't think there's any hands that have been put up, so feel free to go back through whenever you were up to, Dr. Shield, on the questions. I think I'm quite back down towards the bottom. The rest of them are quite similar. Guys, this is your chance to ask directly of people who teach on the PLAB courses and now obviously UKMLA as well. So please don't be shy, put your hand up or put your question in.
I was going to say, I've just seen someone's put, where can we get extra questions for the UKMLA? Where can we, sorry, not extra exam questions.
So I think somebody's asking, where can we get exam questions for the UKMLA? Okay, so I assume you mean practice questions, not the actual exam questions. You wouldn't be asking about that in a webinar, of course. So obviously our course, which has been developed and designed for PLAB, has been mapped to the UKMLA curriculum now. So our course is appropriate to both the UKMLA exam and the PLAB exam. So we have available 5,000 MCQs in our question bank. So obviously we would say the best place to get the questions is from us. Obviously you can get a few free sample questions from here and there, the Medical School Council website, etc., the GMC website even. But in order to be able to actually pass your, to prepare properly and pass your PLAB 1 or AKT, then you should do it through a question bank. So again, I think there's a few others. So does a non-European citizen MD graduate from Bulgaria need to sit for PLAB 1 and 2 exams? Can I register with the GMC directly? Yes, you have to sit the PLAB exam. You can't register with the GMC until you've passed your PLAB, and you can't sit PLAB until you've passed your IELTS and OET. Can Hive organize medical attachments for 4th and 5th year? Yeah, I think that's been answered already. I read earlier in the year that UK students don't need to take the UKMLA only, EU students don't need to take the UKMLA, only UK. Is this still true or has this changed? I think we've answered that, but just to clarify, UK students, you said the UKMLA. Anybody outside the UK, unless you go to one of them very few lucky medical schools, which are accepted by the GMC, you will have to sit the PLAB, which is now compliant with the UKMLA, or it will be on the 17th of May and in August. At what stage in medical school should we do PLAB 1 and 2? We've already addressed that. PLAB 1, start preparing in final year. I think Dr. Skill said PLAB 2, you have to do after you've passed PLAB 1. What about the students that are non-UK citizens? Do they need to take IELTS? We've addressed that already. Similar kind of questions. Do UK citizens with UK passport? Yeah, these are all the same. Anybody else, obviously, do put your hand up. Or unmute yourself and interrupt me if I don't notice your hand. Where can we get exam questions? Do we need clinical attachments? before graduating. So it depends where you are studying. You should be having clinical experience and clinical exposure during medical school. However, we are aware of some medical schools around the world who don't get a lot of clinical exposure. So whatever you need, we are here to help. Okay, Jawad, don't worry. I've seen that you've raised your hand. I'm just going to go through these first and then come back to you if that's okay, because you already had a chance to ask a question. After 2025, yeah. So UK graduates graduating 24-25 onwards will sit the UKMLA. General rule, anybody outside the UK, you'll be sitting PLAB. Difference of IELTS OET, that's been answered. Graduating from Bulgaria 2026, you will have to sit PLAB, which might be called UKMLA International or UK or PLAB UKMLA 1 or something. We don't know what the GMC might do, but you will be having to sit something, whether it's called PLAB or UKMLA. We're not sure yet. All we can tell you is what's happening at the moment. Clinical attachments. Where can I get questions? Do we need clinical attachments? Sent an email to GMC about the MLA, and they said that for the next 5 years, EEA qualified doctor will not be required to sit the MLA. But you mentioned that graduate PLABs will be turned into the UKMLA since you're graduating in 2026. Okay, I think if you've clarified something specifically with the GMC about your institution, that's fantastic. We're just sharing with you the current GMC information based on their, based on the information available through their website and the other resources we mentioned. Okay. All right. So I sent an email that was mentioned again. When should we start preparing? When should we start preparing for the UKMLA? Which year in medical school? Okay. Somebody called Maha. Well, UKMLA is going to be part of your finals exams. Most medical schools, as far as I understand it, it's still the case. You have exams every year. So you can't really start preparing for UKMLA until you enter the latter stages of medical school. First, you have to get through year 1, year 2, year 3, etc., etc. When you get towards the latter end, start preparing for the UKMLA or your finals. And of course, we'll be there to help you as well. Do you have any information specifically for UK students studying in Bulgaria? Dr. Shkil, I want to hand over to you on this one. As you know, the Bulgarian system pretty well. And then we'll go to Jawad. Don't worry, I'm not ignoring you. You can ask your question again. So, Dr. Shkil, please. Sorry, it's the final question. So, do you have any information specifically for UK students studying in Bulgaria? Sorry.
It's the same for us, for anybody else after Brexit, either you or graduate from Bulgaria or India, Bangladesh, Pakistan, it will be the same. As the GMC website says, unless you are from the country where your primary medical education is exempted. So whether you're coming from Bulgaria or you're coming from India, you will be the same. You will be treated the same way. You have to take the exam, you have to take the English exam, you have to take the MLA, PLAB 1 and PLAB 2, and clinical attachment in the job.
Thank you, Dr. Shkil. And just to add to that, if you've had some, if you approach the GMC directly and they give you some direct communication about your institution, obviously, then you have to believe the GMC. They won't be trying to give you the wrong information, but we're telling you general rules. Okay, Jawad, please unmute yourself and ask your question as you wanted to ask another one. And anyone else, please, do put your hands up and ask. It's now or never. Well, it's not never. So now or the next webinar. Go on, Jawad.
Yes, I sent the question about the email to GMC, but when we asked them, we didn't ask about like our specific university. We only asked for Bulgaria students, and since Bulgaria is from the EEA, and you said that the PLAB will be turning to UKMLA, does that mean we'll not set any exam, or we're going to set like one of the two, whatever is like available to take?
Sorry, I think just to clarify, because I had my sound off for part of your question, are you asking whether you are sitting the PLAB or the UKMLA or neither? Is that the question?
Yeah, because in the email they said for EEA like graduates, they will not need to register or pass the MLA for like the next 5 years.
Yeah.
And,
Okay. Yeah. Okay, so sorry, I have to do a bit of intellectual gymnastics and imagine the exact wording of your question and then the GMC's response. But what I would understand from that response is that you will not have to sit the UKMLA, because that at the moment is specifically a licensing exam for UK-based medical graduates. As you are outside of the UK, you won't have to sit the UKMLA. But as we've said, we've been doing this for years and years, and unless the GMC have just changed their guidance, within the last couple of days, anybody graduating from outside of the UK, as I said, apart from a few exceptions, Sweden comes to mind immediately. None of the other countries or institutions do. That's just a bit of ignorance on my part. Generally speaking, international medical graduates, you have to sit the PLAB wherever you are coming from. The only thing that we're trying to explain is that the PLAB will become compliant with the UKMLA exam. That means that they will both be testing for the same or similar kind of things. The GMC wants to standardize as more than they have done already, and it's done a lot, obviously, because most people go through foundation program, most people go through some form of training program, but they want to go even further and make sure IMGs and UK graduates are as close as they can be in terms of standards, skills, knowledge, behaviors, as we mentioned earlier. So outside of the UK, PLAB, inside of the UK, UKMLA, is just that the PLAB is becoming compliant with what the UKMLA is testing for. That's all. That's our understanding, and that's the information.
I just
But
shared the link in the chat. That's really from the GMC website. So there were people asking that, oh, I'm after 5 years, I'm exempted for UKMLA for 5 years and this and that. No, this is from exactly from the GMC website, and you can read it what it says. Local graduates will be taking MLA, and anybody else will be taking CLAB. That will the content will be the same as the MLA, but it will still called CLAB. But slowly they will change the name from CLAB to MLA to standardize it. So there were lots of questions. There were people that confused that we could not find any information anywhere where it says the European students they are exempted until 2028. They are not GMC not going to take any exam. Are there exempted? So if you have any those information on GMC confirmed you, you have to email those share with us, because this is from the GMC and these are the latest information. So if you have received information, please do share with us where you are getting exemption till 2028. So that will be knowledge for us, information for us as well. Thank you.
Okay. Right. Does anybody else want to specifically ask any questions? Oh, Maria, yes, please.
Yeah, hello.
Unmute yourself and go ahead and ask your question.
Hello, I just want to ask about the clinical attachments that you mentioned before. I'm a non-UK citizen and I study in Sofia, Bulgaria. And I was wondering, how can I do clinical attachments in UK as I'm not from there?
Right. So obviously you need to take 3 steps. First, once you graduate, you finish your degree, you need to pass your English test. After that, you need to do the part 1, lab 1 or equity. You can take anywhere in the world. So once you have passed your 1, lab 2 or UKML part 2 happens only in Manchester in the UK. So once you come here for the lab 2 exam, once you have taken your exam, you will have 2 weeks for the when you will be waiting for the results. So during those 2 weeks, we will arrange your placement. We will review your CV. We will provide you other information. We will prepare you for your mock interview and interview preparation, CVD courses. So we'll take you through all those material and resources during that time. So if you are not British citizen, you don't need to worry. Once you come for the PLAB 2 here, we will sort out everything for you. Just get in touch with us once you're preparing, when you start preparing for the PLAB 1. But if you're going to register with us from the day 1, we will sort out everything for you. So everything will be well planned for you. It will take you 9 to 12 months. So all your journey, throughout your journey, will hold your hand and take you through the journey.
Thank you so much.
All right.
Okay, that's great. Which year do we need to do?
Again, it's final year. Once you do the final year, best is start preparing for the PLAB, IELTS, OET, PLAB 1 and PLAB 2. So you're not wasting any time. because finally you'll be fresh, you'll have the good tempo of studying, and then you can prepare it and get it done.
Sorry, I was unmuted, muted rather. Somebody asked, what if you're fourth or fifth year? I think that's in relation to the clinical attachments. Unless I'm mistaken, I think a few people have asked that, you know, even before graduating and even before doing, you know, OET or whatever, or passing the finals, can they get clinical attachments in the UK? So, Dr. Skill, if you want to tackle that.
Yes, definitely. If you are a British citizen and you're coming back to UK, you're studying anywhere in the world, and you're coming back to UK during your holidays, your fourth year, final year, or third year, we will help you to get the placement. A few weeks to few months, that will help you to give you enough orientation, induction to the NHS. So just get in touch with us when you are back in the UK. We'll help you. But if you're not British citizen, obviously you won't be coming before you have passed your English and Club 1. So you don't need to worry. But if you're a British citizen studying anywhere in the world, whenever you come back to the UK, get in touch with us and we will sort out everything for you. Can she charge anything for this? You mean for the clinical attachment? Right. Yes, you get in touch with us and we will provide you all the details.
Okay. I'm okay personally. Dr. Skill will be always available, so we don't mind staying on. I'm just conscious of our other colleagues who've taken out their time and some of our staff members and their time. So I'm going to say another 5 minutes, and after that we'll have to wrap up. You know, now's your chance. Either unmute yourself, raise your hand, or put it in the chat box. So Maria, I think you asked a question before. Which year do you think is best to get in contact with you to start the preparation? I don't know what you mean specifically, whether it's the English test, PLAB, or attachments, etc. However, generally speaking, as we've mentioned a few times, you know, it may have got missed. If you are towards the latter end of your medical school, your fourth or fifth year, you're close to your final year. Obviously, some of you guys do 6 years, 6.5 years, I believe. So if you are heading into your final year, then you should start. You should get in touch, or even if you're the year before your final year, get in touch with us, and then we can advise you when best to start preparing for first your English, then your PLAB 1. And obviously, they're the first 2 steps that you will have to clear. Right. Can you repeat how much you charge to help us finding clinical attachments? I don't think we mentioned anything about a charge for clinical attachments. All we said is you have to get in touch with us. Clinical attachments are obviously, we use our networks. A lot of them, you don't do a clinical attachment with Hive Medical Academy. Point is, just get in touch and we'll help try to arrange one for you. People are saying they're having issues hearing. You guys, everyone else is okay? Okay, so it might be some specific people. If you fail OET or IELTS, how long do you have to wait to repeat the exam? There's quite a specific question. Dr. Gill, do you know, or Ma'am Noreen? I don't know either.
Yeah. You can book it the next available one, but depending upon how good you are prepared. If you're preparing with us, obviously our tutor, she will assess you properly to make sure you pass your exam first attempt. But if you unfortunately fail it, again, she will go through with you, everything, make sure you're well prepared, and you can book it next available date to pass it.
Jawad, Sweden is the only one I know off the top of my head. It's quite straightforward. Jawad's asked which country is a special case. Sweden is the only one I know because it's the only one I remember when I was looking at this stuff. Every time I look at it, Sweden's always mentioned. So it's quite easy for you to determine yourself. If you go on the GMC website, obviously we mentioned some rough guidelines there. If you go on the GMC website and you go to the section where it talks about your medical qualification and the validity of your medical qualification, all the information is on them pages. And if your institution is not mentioned there, then you can specifically ask the GMC a question about a specific institution in a specific country. And yes, thank you, Michelle. Hive does help with OET and IELTS. Okay.
I must say that, you know, we the only academy, we will help you throughout your journey. We will provide you one-stop solution. We will take you from English test, we'll help you to pass your PLAB 1, we'll help you to pass your PLAB 2, we'll help you to get the clinical attachment in NHS, and will help you to get the job, will prepare you for the interview. And even after the job, once you are in the training or non-training course, you need a CPD, or you need help with your appraisal portfolio, we will be there always for you. So we have the academy, will provide everything for you. And once again, I will mention something about, the special offer for today. But we are offering discounts specifically for the people who attended our webinar. This will be available till midnight today. That's, plan one premium package, which you have got the video courses, audio courses, you have the 10-month test, you have the 5,000 plus MCQs. This is just for £180. And then you have the Club 1 and Club 2 premium packages. You don't need to worry, you're done prepared, and you'll pass your exam just for the £750. And then you have the arms loyalty, you have 10% off. And this offer is available to anybody who attended this webinar today. If they book it today, either they want to take until within 24 months. So they need to pay the same price. They don't have to pay. Obviously, prices will go up. Normal prices will be very high. Prices will go up like after 6 months or 12 months. But if you book your exams today with us, people who have attended the webinar, they will pay the same price which is available today.
Brilliant, thank you. Now, I am a stickler for time, as all my colleagues know, so I'm going to stick to that limit of 5 minutes. I do apologize if anybody didn't get to ask a question. Hopefully, we gave everybody enough opportunities. As you can see on the screen, our website is there, our email is there, one of our numbers is there. We are available, and we really do mean it, and you can test this out if you like, 24/7, at least while we're awake. We will get back to you as soon as we can. So any questions, queries, you want to approach us about anything, you need some advice, you want to ask for help, you want to ask about our packages, whatever it is, you're still confused about the whole process, no worries, just get in touch. Thank you very, very much to everyone, especially all the attendees from everywhere. And thank you to Michelle, Dr. Skill, Karen, who wasn't on the webinar, but she helped us a lot, Mam Noreen, Sana, Hidat, and everyone else. Sorry if I forgot to mention anyone. Michelle, feel free to have the last word, because it's your right, and I just hogged it.
Thanks. Yeah, that's basically it. Thank you, everybody, for the last 28 or so who were left on the webinar. We hope you've enjoyed it. As we said, please get in touch if you need anything, or our socials and everything. The websites will be put in the chat. And yeah, we hope you've enjoyed it. I hope it's been informative. And we really hope you take advantage of the special offer today. And yeah, we hope you have a good rest of your day. I think that's it. Okay. Thank you very much, everyone.
Bye-bye. Good
Bye-bye.
evening. Good night.